important because when you're going through that injury and day to day, it's very easy to get pigeonholed into, you know what, I've been doing the Advil trick, I've been doing my therapy, and today stinks, and my knee's no better. But if you look back over those 2 weeks where you just kind of put in general comments on how you were feeling, you might see that there's actually a trend and you're just having a bad day. So I think you have to be patient with the healing, and as long as you've had symptoms, that's pretty much how long these injuries can take. And sometimes they can take even longer than that. So I think with that, I'm gonna leave my little talk, and then unless Joe has something that he wants to add in there, I think if Allie, if you've got some questions, why don't you post those up to us?
Mark, I will add one sweeping statement, and that is that 60% of the injuries that both Mark and I see are injuries that are really related to some kind of training error, and so those are really preventable injuries. And if you do keep an injury log and keep a log of your training, you will be able to almost pick out the time that you broke down. And what you want to look for are some kind of change. And it's either a change in the intensity of a workout or the distance of a workout or the change of your equipment. And it could be from an old shoe to a new shoe. And a new shoe can be the impetus or the nidus for causing an injury. So you look for changes. You could have woken up one morning and just been under the weather, and you went out and trained anyway, and then that's when your knees started to give you some difficulties. So injury logs are critical. You can avoid just about all of the injuries that occur to you. And it's the other 40% that are going to require some kind of professional help. That's when you really have to seek the help and do it early on.
Excellent. Those are great points. So I'm just hopefully people are typing in some questions here for us. We have about 30 people on our list here, so hopefully someone's got something that they want to know.
So Dr. Klion, I just got a question. The question is, what are your thoughts on the best way to approach IT band issues resulting in knee pain while running?
So IT band, this is a really tough one. IT band, so that's called iliotibial band friction syndrome. That is an entity, it's an overuse injury that occurs on the lateral side, that's the outside aspect of the knee. It is a situation in which there is a layer of tissue which is called the tensor fascia lata, which starts and originates up at the hip, runs down the side of the leg and across the knee. In doing so, it crosses paths with our femur, the distal thigh bone on the outside, and makes contact every single time we bend our knee, every single time we are in a single leg stance. And that pretty much is all of running. Running is a single leg sport. There's never a single moment when you are running that two legs are on the ground at the same time. So you're repetitively performing a single leg squat every single time you plant that foot. With that overuse, the IT band or the tissues around it start to become tight. Now that's a relative word because what we are finding out now is that it's not always the IT band that's so tight, it's other aspects of the body, from the hip flexors, the hip capsule, to the lower back, to the calves, that are really the inciting aspect of this IT band, and the IT band is just the presentation of the injury. But as it is, the classic signs and symptoms are someone will describe, I run, I start to feel some tightness on the outside of my knee, and I have to stop, usually have to stop. And it occurs at 1.1 miles. Well, maybe for some it occurs at 9.1 miles. But I know every single time that I've gone running, that's when it occurs. When I try to start running again, it feels as if someone takes a knife or an ice pick and sticks it in the side of my leg. And when doing so, I cannot run. That's kind of the classic history. That's not always the case. So when I see patients like this is one of my knee-jerk responses, is that physical therapy is a necessity for this. Yes, it helps to stretch the IT band, but you definitely need to address some of the other abnormalities that you might find. And again, what I alluded to, from calf tightness to hip joint tightness to lower back issues that are throwing off gait. And it's helpful to have someone who can do a real running analysis on you, that has some experience on looking at gait biomechanics and assessing whether there's a trunk abnormality, there's some other aspect that's really the inciting issue. Obviously, from an orthopedic standpoint, we always say, well, look, there's some inflammation between the IT band and the bone that it rubs over, and that's a little sac of fluid called the bursa, and that gets inflamed. Well, obviously, we do all the same things. We treat it with some ice, so we ice that area religiously. We sometimes take a course of an anti-inflammatory. Now, people might say, well, why take anti-inflammatories? It's just masking the pain. I don't prescribe an anti-inflammatory unless I'm doing it for a specific reason to reduce the inflammation. It doesn't mean that I say, go take 3 Advil 3 times a day, and hey, go run the marathon. I mean, sometimes we have those conversations, but it's really meant to start you on the path of recovery. Sometimes an injection in this scenario to the bursa of the IT band can be helpful, but sometimes it's just a Band-Aid on a bleeding wound, so you have to be careful with that. The end result of a well-addressed physical therapy program, icing, Advil, sometimes changing of the shoes. Maybe Joe can address a little bit of the orthotic issue or shoe issue, but surgery is the last resort for this. People do when they have chronic symptoms, and a good number of people, I would say approximately 40 or so % of people end up having chronic IT band symptoms. That's not to say that I operate on 40% of them, because I don't, because it's not such great results. It's probably a 50-50 shot that you completely get rid of your IT band symptoms with surgery. So it's problematic, but it needs to be addressed kind of from a multimodal aspect. You can't just say, oh, hey, sit on the couch for 6 weeks and then go back to running. You really need to address abnormal biomechanics, look at strength aspects of core weakness, look at shoes, look at orthotics, do the icing, do the anti-inflammatories, and see where you get to. Joe, what do you think?
All really good points, Mark. Iliotibial band is one of those injuries that I shut people down for almost immediately, because it can become a very chronic problem and it can become pretty debilitating, pretty limiting when it comes to training. There are 3 or 4 factors that I see consistently with people with iliotibial band, besides the inflexibility, which seems to be where people on the side that the iliotibial, can you hear me? On the
Yep,
side of the iliotibial band. 2, I find that individuals who have iliotibial band usually have very limited motion in their feet, meaning they're people whose feet are usually normal arched or high arched and don't have the ability to pronate during their running cycle. So they have a very restricted range of motion. I also find that individuals who have iliotibial band, it's usually on their shorter side. So it's short leg we take a look at. We take a look at hamstring strength, take a look at motion in the feet. And then when we take a look at the shoes, I find that shoes that are too soft and break down quickly laterally have a tendency to be an underlying precipitating caused iliotibial band. And then I also find that if you are in a shoe whose heels have worn out too much laterally, that will also lead to iliotibial band. So you have to sort of look at all of these factors, and and see, and usually it's one of these factors or a combination of factors that will lead someone to iliotibial band. But the real take-home message here is that if you've got it, seek help early and try to find out those factors that that might be causing the problem.
Yeah, and I think the other comment to that too is that, interestingly enough, running when you have it is the one sport that really aggravates it, but usually biking and swimming are pretty manageable. And even water running, which is a great alternative in this scenario, is a great way to kind of keep your kind of sport-specific, training going. But as I agree with Joe, that you definitely need to seek out some help. So I hope that answered the question. And Allie, do you have another one?
Yes, I do. I have a question here, and it's has a few questions within the question, so I'm going to read the whole thing. How much strength training should be incorporated into triathlon training? Would that affect the performance during the regular cycling and running workouts? And would that be beneficial for preventing injuries?
I think that's a great question, and I can tell you that now at the age of 50, I am routinely strength training during the season. Preseason, I'm at least doing 3 days a week. Racing season, I'm doing twice a week. As you crest past the age of 30, 35, the hormonal changes that start to occur, like with bone loss, which occurs, lean body muscle mass also occurs. We know that with a repetitive sport, whether it's cycling or running or swimming, yes, you can develop strength, doing hill repeats, doing jumping exercises, for running, you can get stronger, but you need to maintain the health of the muscle. And the only way to do that, honestly, is with strength training. I think obviously there are times when you should be lifting to failure. I think there are times when you should be doing maintenance. And obviously maintenance is better done during the season. Preseason, lifting to failure if done under a well-guided program, I think is great. I think there's a lot of controversial studies that are out there of whether or not it actually increases performance. I don't necessarily know whether it increases performance. I definitely think it decreases injuries during the season. I think only if you are doing some crazy stuff with, let's say, lifting to fatigue, 3 days before a race, yeah, that would adversely affect your performance. But I am a very strong advocate of strength training. I mean, we see, all these overuse injuries that are just due to breakdowns. And it's because there are inherent muscle weaknesses with the IT band, with runner's knee, with posterior tib issues around the foot. We see inherent weaknesses around the joints, and they're there to protect our joints. So I think it's really, really important to maintain a program both preseason, during season, and even postseason, to stay healthy and to prevent injuries.
Yeah, I agree. When you're doing a lot of these activities, the activity itself promotes an imbalance. And so that if you're, for example, if you're primarily a runner, there's a natural imbalance that occurs between the muscles that propel you forward and versus the muscles that decelerate you. For example, when you run, your hamstrings have a tendency to be stronger, your calf has a tendency to be stronger, and the muscles in the front part of your leg, your quadriceps and your shins have a tendency to be weaker. So understanding that you're going to be doing these activities and that the activities that you're doing promotes an imbalance, you have to keep that in mind and work on those muscles that are going to be inherently weak. Same thing occurs when you cycle. There's a